A signed consent form indicated a client should have an electromyogram, but a myelogram was performed instead. Though the myelogram revealed the cause of the client's back pain, which was subsequently treated, the client filed a lawsuit against the nurse and healthcare provider for performing the incorrect procedure. The court is likely to rule in favor of the plaintiff because these events represent what infraction? A quasi-intentional tort because a similar mistake can happen to anyone. B. Failure to respect client autonomy to choose based on intentional tort law. C. Assault and battery with deliberate intent to deviate from the consent form. D. An unintentional tort because the client benefited from having the myelogram. Answer C. Rationale. The client was not properly informed of the procedure, and failure to obtain informed consent constitutes assault and battery. C. A. As injury to economics and dignity, such as invasion of privacy or defamation of character. This is not an incident of failure to respect the client's autonomy. B. An unintentional tort. D. Is an act in which the outcome was not expected, such as negligence or malpractice. The nurse determines a client's IV solution is infusing at 250 milliliters per hour. The prescribed rate is 125 milliliters per hour. What action should the nurse take first? A. Determine when the IV solution was started. B. Slow the IV infusion to keep vein open rate. C. Assess the IV insertion site for swelling. D. Report the finding to the healthcare provider. Answer. B. Rationale. The nurse should first slow the IV flow rate to keep vein open, KVO, rate. B. To prevent further risk of fluid volume overload, then gather additional assessment data, such as when the IV solution was started, A. And the appearance of the IV insertion site. C. Before contacting the healthcare provider. D. For further instructions. Question number 3. What intervention should the nurse include in the plan of care for a client who is being treated with an Unis paste boot for leg ulcers due to chronic venous insufficiency? A. Check capillary refill of toes on lower extremity with Unis paste boot. B. Apply dressing to wound area before applying the Unis paste boot. C. Wrap the leg from the knee down towards the foot. D. Remove the Unis paste boot Q8H to assess wound healing. Answer. A. Rationale. The Unis paste boot becomes rigid after it dries, so it is important to check distally for adequate circulation. A. NCLEX is often wrapped around the outside of the boot and an ACE bandage may be used to cover both, but no bandage should be put under it. B. The Unis paste boot should be applied from the foot and wrapped towards the knee. C. The Unis paste boot acts as a sterile dressing and should not be removed. Q8H. Weekly removal is reasonable. D. Question 4. When preparing to administer an intravenous medication through a central venous catheter, the nurse aspirates a blood return in one of the lumens of the triple lumen catheter. Which action should the nurse implement? A. Flush the lumen with the saline solution and administer the medication through the lumen. B. Determine if a PRN prescription for a thrombolytic agent is listed on the medication record. C. Clamp the lumen and obtain a syringe of a dilute heparin solution to flush through the tubing. D. Withdraw the aspirated blood into the syringe and use a new syringe to administer the medication. Answer. A. Rationale. Aspiration of a blood return in the lumen of a central venous catheter indicates that the catheter is in place and the medication can be administered. The nurse should flush the tubing with the saline solution, administer the medication, A, then flush the lumen with saline again. B and C are not necessary. The aspirated blood can be flushed back through the closed system into the client's bloodstream, but does not need to be withdrawn. D. Question 5. While preparing to insert a rectal suppository in a male adult client, the nurse observes that the client is holding his breath while bearing down. What action should the nurse implement? A. Advise the client to continue to bear down without holding his breath. B. Gently insert the lubricated suppository 4 inches into the rectum. C. Perform a digital exam to determine if a fecal impaction is present. D. Instruct the client to take slow deep breaths and stop bearing down. Answer. D. Rationale. During administration of a rectal suppository, The client is asked to take slow deep breaths through the mouth to relax the anal sphincter. D. Bearing down. A. Will push the suppository out of the rectum, so the suppository should not be inserted while the client is bearing down. B. Further data is needed before performing an invasive digital exam to check for fecal impaction. C. The nurse is caring for a client who is weak from inactivity because of a 2-week hospitalization. In planning care for the client, the nurse should include which range of motion, ROM, exercises? A. Passive ROM exercises to all joints on all extremities 4 times a day. B. Active ROM exercises to both arms and legs 2 or 3 times a day. C. Active ROM exercises with weights twice a day with 20 repetitions each. D. Passive ROM exercises to the point of resistance and slightly beyond. Answer. B. Rationale. Active, rather than passive, ROM is best to restore strength and, B, is an effective schedule. Passive ROM 4 times a day, A, is not as beneficial for the client as B. With weights, C, the client may fatigue quickly and develop muscle soreness. ROM is not performed beyond the point of resistance or pain, D, because of the risk of damage to underlying structures. Down to the last question, the charge nurse assigns a nursing procedure to a new staff nurse who has not previously performed the procedure. What action is most important for the new staff nurse to take? A. Review the steps in the procedure manual. B. Ask another nurse to assist while implementing the procedure. C. Follow the agency's policy and procedure. D. Refuse to perform the task that is beyond the nurse's experience. Answer. D. Rationale. According to states' nurse practice acts, it is the responsibility of the nurse to function within the scope of competency, D, and in this case safe nursing practice constitutes refusal to perform the procedure because of a lack of experience. Although state mandates, agency policies, and continued education and experience identify tasks that are within the scope of nursing practice, nurses should first refuse to perform tasks that are beyond their proficiency, and then pursue opportunities to enhance their competency, A, B, and C. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Don't forget to subscribe. Again, thank you so much. You'll be great nurses.